didn't know what was wrong with me, and I ended up missing, I think, about a month of school. Like it was quite significant. And then things just sort of compounded from there, where I had a lot of joint pain and unexplained fatigue and a lot of symptoms. And so I would go to the doctor, and they wouldn't know what was wrong with me.
And I can't hide, 'cause growing pains are keeping me up at night.
Hi everyone, welcome back to this week's episode on Take a Pain Check. I'm so excited to have Kate joining me today. Hi Kate, can you give me a brief introduction about yourself? Tell me a little bit about your diagnosis, your education, your hobbies, what you've been up to recently.
Absolutely. And thank you so much, Natasha. It's really great to be here. So my name is Kate, as mentioned. I'm diagnosed with hypermobile Ehlers-Danlos syndrome, as well as postural orthostatic tachycardia syndrome, or POTS for short. In terms of my education, I started out at UVic in a Bachelor of Science in Microbiology. And then after that, I moved to the University of Calgary, where I'm completing a combined PhD and MD degree. So it's within like the Leaders in Medicine program, which is a great opportunity to be able to do research and medical school all in one. Outside of my education, I'm also a Girl Guide leader, which is something I'm really passionate about. I've been doing that for a while now, so it's lots of fun to organize camps and spend time with the youth during different activities.
Nice, you sound super busy. So
Yeah.
we have lots of things to talk about, Kate, and it's just honestly so amazing to have you because we've been going back and forth over email and we'll get into a little bit about what all that's about soon. But yeah, it's honestly amazing to have you on the podcast. So let's start off talking about your diagnosis journey. So when were you diagnosed with the conditions that you do have, and how did you realize I need to go see the doctor?
For sure. So definitely for me, it has been a major challenge, and it was a major part of my life. So I first started noticing problems when I was 11. I started having, oddly enough, it started out as like a gastrointestinal illness, and there's just really built from there. And it took, in the end, about 12 years to actually receive my final diagnosis. So that, of course, in my, young adult and teenage years caused a lot of problems with school and everything like that. But I guess I initially went to the doctor when I did have that GI illness, and they didn't know what was wrong with me. And I ended up missing, I think, about a month of school. Like it was quite significant. And then things just sort of compounded from there, where I had a lot of joint pain and unexplained fatigue and a lot of symptoms. And so I would go to the doctor, and they wouldn't know what was wrong with me. And then I think one of the additional challenges was that I'd have periods of time where I was worse, and then periods of time when I was better. So it would kind of get better, and I'm like, oh, I guess that's over. Like I'm okay now. And then I'd be okay until I was really not okay. And then I'd be going back to the doctor, and again, they wouldn't have sort of any idea what was wrong with me. And so that was very challenging. And it was I had a lot of back pain, and I think I did horseback riding, and we wondered if it was from like a horseback riding injury. So I was referred to physical medicine, or physiatry, it's also called. And that doctor, when I was 18, was the first time that someone recognized, oh, like there's something not right here. And it was because he'd been a dancer with the National Ballet. So he was very familiar with hypermobile joints and hypermobility. And, he was the first one to say, like, you should not be able to extend your joints like this far. Like, I think that you have at the time he said hypermobility syndrome. And so that was the first time, I guess, that it was like, oh, like there is something going on here, and this is maybe what it was. And so he was able to refer me to a physiotherapist who was able to give targeted physio, because one of the problems with EDS is it's really easy to get injured. So if you don't have like proper physio or someone who's aware of that, it's almost like more harmful than not in some cases, at least personally from my experience, maybe not everyone's experience. So that physiotherapist was able to help me, build strength and get stronger. And then I was actually able to finish high school. And I think I would attribute it that both to the physiatrist I saw and then the physiotherapy. And then from there, it was part of the picture, the hypermobility, but it was not the full story. And so and I think we'll maybe get into it a bit later, but I did have some challenges finishing high school and university. I guess I just continued to have sort of illness symptoms. And then I sort of asked my doctor, like, could I see a rheumatologist? Like, I think this is not just joint hypermobility syndrome. I think it might actually be Ehlers-Danlos syndrome. And so then I ended up seeing a rheumatologist, and he was like, confirmed the diagnosis, like, this is what you have. And then he suggested I might have POTS, which is a problem with the autonomic nervous system. So that's what controls like your heart rate, your breathing, all of like the automatic processes in the body. And so I then saw cardiology a year later, and she confirmed that diagnosis as well. So it was definitely a journey, and there was no recognition early on of what might be wrong with me, and that created a lot of problems.
Yeah, it sounds like there was this huge gap in the middle of I don't know what's happening, but no one can help me. And
Yeah.
as someone being so young and as a teenager, how did that make you feel like personally on an emotional and like social level, like even interactions with peers and just feeling left out? How did that work for you?
Yeah, it was really hard. I think in multiple ways, definitely socially, definitely academically. I had been doing pretty well academically, even in grade 9, I got an award because of my grades. And so then to basically fail grade 10, essentially, like I couldn't finish grade 10, was really hard and like really devastating because I think be doing well academically was really important to me, and it was, a health reason that I couldn't finish. So that was really disappointing, and I think I lost a lot of confidence. And especially because we didn't know what was wrong with me. Like, I think if I had known, like, oh, I have this specific medical condition, that's why I can't do this, but it was so vague and unknown. And I think I really doubted myself. Like, am I even really sick? Like, is there even really something wrong with me? Or am I just like not smart enough to do this? And so that was really a challenge that I had throughout all my high school and university as well. And then socially, it was also really challenging to explain to people. Like, I remember this one specific interaction with someone who said, oh, like you're never at school, but you're not in the hospital. Like, what is wrong with you? And I'm like, I don't know what's wrong with me. Like, it was really challenging. And I think as well, like a lot of the time, I would get invited to things, but I couldn't go. And eventually you just don't get invited anymore. So that was really hard as well, to lose friends and to try and explain, like, it's not that I don't want to be at the party or the activity. It's just that I'm too sick to go. And I did have like a core group of friends who have like stuck with me, and we're still really good friends, and they were amazing. But a lot of other people I definitely lost along the way just from lack of understanding, and as well like lack of my understanding as well. Like, I couldn't explain what it was because I like also have no idea. And as well, like, one of the other challenges I find with my illness is it's can be worse and better. So sometimes I might be able to do the hike or do the activity, and then other times I can't. And I feel like that's also challenging. So it was hard. It was really hard. I lost confidence. I had, challenges with academics and challenges with friends, and it was just a challenging situation for sure.
Yeah, it sounds very challenging and just like not being able to understand that condition yourself. How can you explain that to anyone else? Like you really can't if you don't understand it. What was going on in your like parents' mind during this time? And I guess whoever was living with you and just like your family.
Yeah, so I was living with my mom. My dad actually passed away when I was quite young. So it was just me and my mom. And I think it was really hard for her as well because she also like didn't know what was wrong with me. And she was trying to do the best to take me to the doctors and do what seemed right. But, when the doctors don't know either, it's really hard. But I feel like I'm really grateful for my mom. Like, she always believed me. Like, she always believed that I was sick. And she actually recently told me, and I didn't know this, that some of her friends told her that they thought I was faking it. But she never thought that ever. Like, she was always with me 100%. So I'm like so grateful for her. And I think it was just hard. Like, it was stressful, especially like when I didn't finish grade 12. Like, that was really devastating. But she's always stuck by me and believed in me. And I'm really grateful for that.
Yes, and let's just kind of jump right into the whole high school, university stuff because I mean, I've kind of read a little bit about your story and your journey, but I really think people would be curious to know how did high school go for you? I know you said that you didn't do too well and you're a high achiever, which I resonate with a lot too, but yeah, let us know a little bit about what that journey was like living with chronic illnesses and just getting through school.
For sure. So I think like I did get sick when I was about 11. But I think because like grade 7, 8, and kind of 9 was, I missed a lot of school, but I was able to keep up. Like, it wasn't a problem. And so I was able to continue. And I think My mom was like really involved in the school as well. So I think that they were really aware that it was like, it wasn't like I wasn't showing up. It was like I was unwell. And then grade 10 is when it started to become like really hard to try and keep up. And I just wasn't able to finish. So I think in grade 10, and I don't know how it is, I know it's different everywhere, but at my school, it was like you did classes from like September to January, and then you did new classes from like February to June. So I was able to finish like math and science in the first part of grade 10, and like that was it. I couldn't finish the rest of the year. So that was like really upsetting. And so the next year, they were able to make it work that I did grade 10 and 11 together. And they were able to do this by giving me these like independent study blocks. So I completed like English and Social Studies 10 in like one block. And that allowed me to then do the grade 11 classes in January. So after grade 11, I was feeling pretty good. And that's like the other like weird thing with this illness is like I was really sick in grade 10, but I was well enough in grade 11 to get through it. And so I was feeling pretty good at the end of grade 11. Like I was back on track with my friends. Like this is going to be great. I'm going to graduate on time. And then grade 12, I was super sick again. So similar thing. Like I think I finished chemistry and biology in grade 12, and then I did not finish grade 12. And that was probably the hardest because all my friends, you know, went off to university and were getting on with their lives. And here I was having to like repeat grade 12. I mean, there were some good things, like I was allowed to go to my graduation, even though I didn't graduate, which was really nice because it was my friends and I wouldn't have known people the next year. And the school was really accommodating. Like they were like, absolutely, like you can repeat the year. So there was supports there, but it was still just really devastating. Like I had all these plans like to go to like away for school and I was stuck sort of repeating grade 12. And so it was kind of at the beginning of that repeat grade 12 year that I did see the physiatrist and get my hypermobility diagnosis. And that's, I think, why I was able to finish, because I was able to get that targeted physio that really helped me for my specific condition. And so it was the joint hypermobility diagnosis at that point, but similar physio to EDS. So that was grade 12. So then I made it through grade 12 and I was on like a half course situation to get enough courses to graduate. And then I initially had wanted to go away for school. So I'm from Victoria and I was set on Ontario. Like I'm going to go to Ontario for school. I'm going to go away. It's going to be great. And then because of my illness, we decided like I should stick at home, which makes sense. And so I decided to apply to UVic. And so I started university at UVic and I got through first year, which was really great. And then second year, again, we run into problems. And unfortunately, very tragically, the physiotherapist that I was seeing actually suddenly died. And so that was a further challenge and obviously like devastating for everyone, but I was not able to get that sort of targeted help that I needed. And so I ended up having to repeat year 2 twice, just because I was so unwell. And every time the challenge was I would start to get symptoms, and because we didn't know, like we knew the hypermobility, but not the full extent, I wouldn't know how to treat it. And so it would just get worse and worse and worse until I was unable to go to school. So overall, that kind of kept happening in my undergrad degree. Like I could do a bit, I couldn't, until I received like the EDS and the POTS diagnoses in 2014 and 2015. And then I was able to have a successful management plan and finish my undergrad. So overall, my undergrad degree took 8 years, so double what it was supposed to, which was not the plan at all. But I was able to get through it. It just was quite challenging.
Do you think that because you did like 8 years of undergrad and didn't do too well academically at some point in your life, like did that impact any chances that you had at a grad school or anything like that? Did you find that fear of like, oh, because of this, I might not get in, or did that happen?
I guess like I was a little bit lucky in that like when I was at university, my grades were okay and I was able to get withdrawals like when I was not there. So like my first year wasn't great, but overall my GPA was not horrible. But I definitely thought like even before I was sick, like my goal was always to be a doctor. And I thought there's like literally no chance that I'm ever going to get into medical school now, which was also like really challenging because that had always been my goal and what I was working towards. And I thought like this, like someone might look at this 8-year thing and think like there's no way. So I think it was a lot of personal self-doubt. That was the challenge. But how it worked out for grad school was I actually emailed. So I guess how it kind of worked out was I was in microbiology and I was always set on medical school. Like that was my plan, like do my undergrad, do medical school. I didn't know what type of doctor I wanted to be, but I wanted to be a doctor. And I had never considered researching what I have or researching really in general. There were some research opportunities in undergrad, but because I was really focused on sort of getting through it and being healthy, I didn't explore that. And I think a little bit of maybe self-doubt as well in being able to do research in undergrad kind of prevented me from that. But it was actually, so I had a new physiotherapist at this time who was also really great. And he said, have you ever thought about studying your conditions, which I had never thought of. And that kind of sparked an idea. And so I had been doing a lot of reading about my conditions, with the diagnosis, and there was this name that always kept coming up. It was like Satish Raj, like Dr. Satish Raj. Like it seemed like he had written every article about POTS. So I looked him up, but he was at Vanderbilt, which is like very far away from me. So that was fine. And then I think I had been doing some more research, and I saw that he had moved actually to Calgary. So I kind of cold emailed him, and I was looking for at the time actually like a co-op work term to finish my undergrad degree. And I said, hey, like I'm a person with POTS, like I'm really interested in doing a co-op term with you. Would you be open to that? And he actually replied right away, and he was like, do you ever come to Calgary? And because I have family in Calgary, I said, absolutely, I'll come to Calgary. And I came and met him and kind of went from there. So how it kind of worked in Calgary was, I think as long as you met the minimum GPA, which is fairly reasonable, I think it was like 3.2 or 3.3, and you had a supervisor who was supporting you, like you would get in basically. So I did, and at least from my experience, like maybe different for other people, but I did a 4-month work term with him, and then he suggested, like, do you want to do a master's degree? And so I said yes. And then in my master's degree, he asked me if I wanted to transfer to PhD. So I think I didn't maybe necessarily go through like the traditional grad school application. I know some programs are extremely competitive, and you have to apply everywhere. It was more, I reached out kind of to a specific person.
And then how did that switch to MD? Or like how did
Yeah.
you get that PhD and MD in there?
Yeah. So I did have so much doubt. I thought I would never get into medical school. And I think I think it's improving, but this was a while ago as well. Like that there was a lot of like, if you don't have a 4.0 and you don't do 10 classes a year in 4 years, like you're not considered. And so I chose to apply like during my grad school. And it actually I was transferring to PhD kind of at the same time that I was applying to MD. And Calgary has a unique program called Leaders in Medicine, which is really nice. So if you get into medical school when you're in grad school, they'll actually almost like defer your med school start. So you're doing like a joint degree. So I only applied to Calgary because I knew that if I got in, they would allow me to do that. So I applied. I didn't think that I would get in. I didn't think that I'd get an interview. I thought this will just be a practice round. I can practice the application and things like that. And then I ended up getting an interview, and it was actually the COVID year. So that was really interesting because our interviews were canceled like the day before, and it ended up being an online interview. That's kind of off topic, but it was definitely an interesting experience. And then I happened to get in, which I was so grateful for. And I ended up deferring to finish my PhD. So I think Calgary especially really values experience, like life experience. And so I was able to, in my application, talk about my journey from patient to researcher to like, doing knowledge translation and patient engaged research. And I think that really helped. And as well, like, I think they drop your worst GPA year. So my GPA ended up being okay for that.
Where are you right now in terms of your education? Like, are you doing your PhD? Are you in your MD years?
So I actually just defended my PhD in April, which was really exciting. So my PhD is complete, and then I started medical school in July. So I guess, about 3.5 months in. We've had our first exam, and we're headed towards our second exam. So I will have 3 years of medical school, and then I'll move on to my medical residency after that.
Wow, you are very educated and very smart. Like, wow, that's amazing. I'm so glad, like, despite all these hurdles, you've shown that you can do so much with your life. And that's sort of what this whole podcast is about, is like bringing on people like you to talk about your journey, because you've been through so much, but you're also doing so much for the community as well. Did you receive any accommodations in like high school, university, during your PhD, and now your MD?
Yeah, thank you so much. And that's a great question. I was thinking about this. In high school, I think my accommodation was mainly like I got excused from PE, like I didn't do that. Um, and then I think like I would get exam extensions and things like that, but it was really like I was kind of just like too unwell to do the program. So high school, a little bit not. And then In university, this is like really not great, but I was like very hesitant to go to like the accommodations office. And I think don't do this, like to everyone listening. But I think for me, like because I didn't have a diagnosis and I thought that going to the accommodation office would mean that I could not be getting into medical school, which is totally false, like and wrong, but it was just a misconception that I'd had. In terms of like I would get exams deferred and things like that, but I didn't actually have a specific accommodation until I got diagnosed with EDS and POTS, and then I went to the accommodation office and got like specific accommodations. And it was mostly that I would have to miss class sometimes, and then I think I had like a little bit of extra time on my exams, so if I needed to stand up or move around, that was um that was what I was given. But I would say like don't do that. Do not do what I did. Like the accommodation office is there to help you and to make you successful. And that if you think that you need accommodations, you should definitely go. It was just my like misconception of med school admissions that prevented me, and also not having a diagnosis. Like that's also hard to be like, I need accommodations, but I don't know what's wrong with me. Whereas I could then go in and say, I have this specific condition, like I need accommodations. So I'm not sure if I'm a great example for that, but I eventually did, and it was very helpful.
Your case is very interesting because you didn't have a diagnosis, and usually in the paperwork they're like put your diagnosis down, get your doctor to like put a letter in or write something. And so it probably makes it a little bit more challenging given that you didn't have like a specific diagnosis. I think you'd be questioned a little bit more. I don't know if
Mhm.
that's true. For me, I'm even being questioned having a diagnosis of like juvenile arthritis. I feel like people that don't have that on the paper, it's probably harder for them.
Yeah, I think so for sure. And I think like one of the problems that's like common is like I don't look sick, I look young and healthy, and I think that just like further compounds like the stigma or discrimination, I guess, in that like how could you be sick? You look young and fine, and then not having a diagnosis on top of that, it just makes it worse.
Yeah, 100%. And also getting accommodations, I think a lot of people that I've talked to, it's hard to even get there or say, I'm gonna go get the accommodations. I think for me, like I was diagnosed in grade 8, so I was already getting accommodations off the bat, and I just find that for me, I needed them. So I didn't really think twice about it, but there's some people that are like, oh, what if that's unfair that I'm getting the accommodations? Or it's hard because now you're living like this whole new life and started feeling symptoms at 11. Prior to 11, do you ever like compare yourself to like, oh, what I was like when I was 10 or 9 compared to now?
I think a little bit like I used to do like all the sports and like all the activities. And so that was really challenging, like from playing like multiple sports to like not being able to do any team sports in high school. Like that was really unfortunate. And so I definitely think I experienced that as well. Like I think looking back, I probably always had the hypermobility, but it didn't become symptomatic until I was a bit older. So I think so. And I think like now, like I've tried to kind of do some of the things like I started doing like field hockey, and like I'm not very good and like but that's okay, like the team's really supportive, and so kind of I was almost trying to do like, oh, I didn't get to do this in high school. And I think for me, like fortunately, like I have been able to develop like good management, and I know that's like for everyone with EDS it's not necessarily the case, but I definitely am limited like in what I can do compared to before.
So in terms of like treatment options, would that just be only physio? What are the treatment options?
So for EDS, like it's a little tricky. So I think for me, like the biggest issues that I had when I was younger was a lot of pain. So back pain, leg pain, and then also my joints are really unstable. So sometimes they'll partially dislocate or they'll get injured very easily. And EDS is really a spectrum. And so some people will have dislocations every day, multiple like they're and fortunately, I guess a little bit fortunate for me, like I don't have the full dislocations, but I have the pain and the partial dislocations and the injuries that come from that. And so I think I just try to be really careful to not get injured. Like I have like a leg injury and a shoulder injury, and I just don't want to sort of get more and more. But I definitely did to have like accommodations for PE, and I wasn't able to do sort of everything. So for EDS, like from my knowledge, it's mostly strengthening and physio. So oftentimes with EDS, people have hypermobile joints, but then like tight muscles. It's kind of funny, like the muscles are kind of doing the job of what the ligaments and tendons should do. So really strengthening that is important, but making sure that you're doing that with someone who's aware of EDS, and because you can get injured. From my experience, if you're not kind of doing that carefully. In terms of medications for EDS, like there isn't any that I'm aware of. It would just be pain management. For POTS, there is a little bit more a selection of medication, but none of them are approved for POTS. It's all what we would call off-label. So this means that they're approved for something else, but we're trying it out in POTS. And so a lot of the symptoms in POTS, it's again a spectrum, so people have different experiences, but it's a lot of like lightheadedness, headache, nausea, your heart is beating really fast, you feel like you're going to faint, you can have GI problems, and other things like that. And so a lot of the medications kind of target those different things. So we can use what's called like a beta blocker. That's something that's going to lower your heart rate. You can use a drug called midodrine, which basically just helps the blood vessels in your legs to squeeze more tightly. Because one of the problems with people with POTS is when they're standing, blood is pulled like down by gravity and it's not getting back up properly. It's collecting in the lower body. So if we can squeeze the blood vessels tightly to push that blood back to the heart, that can help. So it's kind of targeting those different things, but there's a lot of symptoms in POTS that we don't have good treatments for. Like some people have like brain fog or like cognitive problems, like difficulty thinking. That's something that we don't have a good treatment for yet. And a lot of really severe like gastrointestinal problems, which we also don't have a great treatment for. So it's definitely a really under-researched and understudied area. And I think that's one of the contributors to the long diagnostic delay. Like mine was 12 years, but we have research showing that on average it's about 5 years for people for POTS. I'm not sure for EDS, but definitely lack of recognition and lack of understanding and lack of research and lack of treatments is all contributing to this.
I've only heard the word POTS or heard that, oh, people are diagnosed with POTS, but I'm like, I've never really seen too much information about it, don't know that much about it. Like some people on our team have it, so I kind of am learning from them, but I find that it's not something that people always talk about, so definitely super important to raise awareness about it. Did you find that over time your symptoms have improved? You are feeling less pain, less of those symptoms that you used to have when you were like 12?
Yeah, so I think I'm really fortunate. It's a different experience for everyone with EDS and POTS, and some people maybe are getting worse over time. Some people maybe stay the same, but I think for me, fortunately, I did improve. And I think a lot of that was the good physio and the medications that we tried for POTS worked well. And so I feel really fortunate that I do feel like I have less pain than I did when I was younger, and I do feel like my symptoms are better managed. And I think even just knowing what it is really helps because previously, like I would have a flare up, but I would have no idea what to do to help it, and it would just get worse and worse. But now I feel like I can notice like early symptoms, and I have tools like in my toolbox that I can use to try and mitigate it. So I think yes, fortunately for me, like I did get better over time, but it's definitely not everyone's experience, and some people don't experience that.
So you are also like heavily involved in academia with research being your primary focus. When did you decide to get into research? I know we talked a little bit about you kind of reaching out. How did you decide what that was going to be on?
For sure. That's a great question. So it really was when I was in my last year of my undergrad and my physiotherapist suggested I think he said, oh, are you going to do a PhD in EDS or POTS? And that is when I first thought, oh, like maybe I could do research. Like I hadn't thought about it at all. Like I was so set on my path to medical school. And so I had one co-op work term left. So at UVic in the microbiology program, you can do co-op, which is where you do 4 different work terms. So I had like worked at the CDC in Vancouver doing like parasite things and had some jobs like that. And they were really flexible. So I was able to kind of do a research co-op, and it didn't have to be in microbiology, but it had to be like sort of related, and we made it work. So that was my thing is I thought, oh, maybe I'll try out like these 4 months of research and see if I like it. And I was thinking like, would I want to do EDS research, which I did want to do, or would I want to do POTS research, something like related to what I had? And so I reached out across the country, and unfortunately, there's not a lot of EDS research occurring. Like there is now at Calgary at Clinic, but when I was looking, there wasn't. And so I knew Dr. Raj, my supervisor, was in Calgary, and he has extensive POTS research. And so I reached out to him, and he replied, and we kind of went from there. So I think it was sort of very last minute. It was definitely not something that I had planned. I didn't do any research like in my undergrad. I know like a lot of students are like research assistants or have summer jobs. Like I didn't do any of that at all. I just did this one work term at the end of my co-op and then went from there. So definitely a shift from microbiology to studying POTS. And I was really open to EDS or POTS, and it just worked out that POTS is where I ended up. But it was definitely not my plan at all. And then he had set, I just planned on like the 4 month work term. And then my supervisor invited me to do a master's, and we really just went from there. And I realized that I really loved the research. It was really something that I enjoyed. And that led me to the PhD. I think for people considering grad school, like it's really important that you like the topic and you like research, because it is very intensive for a long period of time. And if you don't like your topic or you don't like research, it's not going to be a great experience. But that's sort of why I tried it out as well, like in the 4 month, and then built from there. But it turned out I really enjoyed it, and I hope that it will be part of my career for sure.
That's amazing. Do you have any goals in terms of what you want your research to look like in the future or moving forward?
For sure, yeah. So I think I'm hoping to be a clinician scientist. And so what that is it's like combined like researcher doctor. And there's different ways that that looks. So you can have, like, for example, my supervisor, I think he is like working of 80% of the time on research and 20% of the time on clinical, which means seeing patients. But it can be anywhere on the spectrum. You can do a little bit of research and a lot of clinical, or kind of in the middle. And so my medical school goals are to become either an internal medicine doctor or a cardiologist, looking at women's cardiovascular health and POTS, and then EDS and everything that goes along with it. And hopefully I will have a clinician scientist appointment where I'm doing quite a bit of research as well.
It just sounds like your lived experience has shaped your career path. And so I'm so glad that it's kind of given you that sort of purpose and shown you what you want to do. You also have lots of different publications and papers. Can you talk a little bit about any sort of manuscript you've written and what the focus was towards that? Anything that you want to share in terms of one specific thing that you've written?
Yeah, for sure. So I definitely have some different publications. My research in POTS looked at a few different things. One thing was looking at compression garments. So there are no treatments approved for POTS, and minimal research looking at sort of what we call non-pharmacological, so like non-medication treatments. And so I did some research on compression garments, and we were able to show that they were effective for POTS and things like that. But I think one of the papers that I would like to talk about is one that we looked at anesthetic resistance in patients with EDS. And so this was a really interesting research that's currently, hopefully will be submitted and published soon. But one of the things that we know from patients is that a lot of the time they report that when they go to the dentist or they get stitches, the anesthetic doesn't work properly, and they're having a lot of feeling, which is obviously really painful and unpleasant and stressful. But that hadn't really been tested in a large group. And so we actually did a study where we compared patients with EDS to patients without EDS with a local anesthetic called lidocaine, which is one that's pretty common. So just under the skin, we injected a little bit of lidocaine, and then we also had a saline control. So that would be, it wouldn't provide any anesthetic, and then the lidocaine should provide anesthetic. And then we did some sensation testing. So we basically used like a filament that you would use to test people for neuropathy if they have diabetes. And that specific filament is important because it provides the same amount of pressure every time you use it. And we basically just sensation tested patients with EDS and people without to see if they could still feel things when the anesthetic had been injected. And so this research actually showed that patients with EDS had more sensation with the anesthetic, so the anesthetic was not working as well. And that's really important to be able to show in a trial, because this can then be used as evidence to show that maybe patients with EDS need either like a different anesthetic or more anesthetic. And then there's a real phenomenon occurring that it's not working. It's not just unfortunately, like sometimes patients are not believed. It's not just that they think it, it's like real evidence. And so I was really excited and happy to be working on that project, because I think it will make a real difference in terms of providing evidence. And obviously we believe patients, but having the evidence helps to show that it's a real phenomenon.
That is so interesting, and I honestly would have never thought that something like that would happen to patients, and because we usually almost always think that anesthesia or any sort of form of that would help patients. It's interesting that you're doing research on that, especially because you have lived experience of this condition as well. So excited to see where that goes to. I think it definitely has like a lot of potential as well to like create new innovations, I think, definitely. And so I'm wondering, have you been able to kind of connect like the relationship between POTS and EDS, so like through research that you've done, or do you find yourself that when you are experiencing both conditions, there might have been a relationship, or you have some theories that you might have created?
Yeah, that's such a great question. And it's such an interesting area. So unfortunately, like we don't know yet, like how they're linked, but there definitely does seem to be a relationship. And so, one of the challenges with this is there's a lot of like unproven theories that become adopted as like this is what it is. So, the main unproven theory, and just unproven because it hasn't been studied, is that patients with EDS have stretchier blood vessels, and that could lead to more blood pooling in patients, and that causes like the POTS. Because with POTS, like when you stand up and gravity pulls blood down, the blood's collecting in your lower body, and that leads to a lot of the symptoms. Like your body isn't good at getting the blood back to the heart, whereas in like a healthy person, you are, if that kind of makes sense. So yeah, so that's something that we're working on in our lab as well. So we actually just received a grant to study that in more detail to try and really test that theory. Are patients with EDS, like, do they have stretchier blood vessels? And is that what the relationship is? Or is it something else, which it 100% could be, and we just don't have the research yet, but it definitely does seem to be associated in some way.
Yeah, I mean, hopefully that'll be an area for you to also research if it is something that interests you. I think that it would be so amazing to like eventually share that with patients experiencing potentially both conditions, because I find that patients are not always just experiencing one thing. They're potentially having more conditions and like comorbidities and things like that. So super interesting area for people to research. You've been able to share your research with patients and healthcare professionals just by like publishing and probably like going to conferences as well. So what changes do you hope to see with the work that you're doing?
Yeah, that's a great question. So, like, I'm hoping that it will bring more like awareness for clinicians just to even be aware of like what is POTS and what is hypermobile EDS. And I also hope that, research like our anesthetic study actually leads to change and protocol change. And so that, patients with EDS are actually receiving like adequate anesthesia. One of the other things that we're studying is looking at long-term outcomes in POTS, and that includes patients with both POTS and EDS, because there's another unfortunate misconception that everyone with POTS just grows out of it and it's not a big deal. And that's quite harmful because it's not the case. And, even though maybe I have improved symptoms now, it's not gone. And some people get worse over time. So from our research like that, looking at the long-term outcomes, like we're hoping that that brings more awareness that POTS, is something that should be taken seriously, and medication should be developed and treatments should be developed, because it isn't something that people just grow out of in most cases.
And so, how do you actively engage in the community to ensure that your research is being implemented in the context of the healthcare field?
Yeah, that's a super great question. So I think we do, at least in our lab, we do some different things. So we'd always make sure, like when we're designing studies, to have patients engaged. So we want to make sure that the research that we're doing is important to patients. So we have done like surveys and sort of almost like a focus group type things. And we often like have one-on-one conversations with patients just to make sure that what we're doing is actually relevant and important. And then a lot of the time we're able to kind of partner, like, so Dysautonomia International is like an organization for POTS and other autonomic disorders, and we're able to do webinars and present at their patient conference. And so hopefully we're able to kind of spread the word, I guess, of our research, with the patient and the broader community. And then in terms of the healthcare system, like being able to publish research that's citable can then be added to like clinical guidelines. And so that's what we're hoping. So for compression garments, which is what I studied before, they were recommended all the time, but there was actually no study in adults with POTS that they worked. So that's hard to provide a clinical guideline for something that there's no evidence for. But now with my research, it can be cited in a clinical guideline. So that's sort of the other approach.
That's amazing that you're finding different ways to kind of approach all sides of just like healthcare. So like for patients, engaging patients in research, which is so important. And then the other side of like clinical practice guidelines, thinking of things like that. I find that oftentimes that is not the top priority for people that are doing research or are practicing care, and like you being a patient and then thinking of all these things outside of just like, okay, I'm going to do research and I'm just going to publish it, and making sure that the research is relevant. I think that's so important. Like I'm also engaged in patient engagement and research, and I find that it's so important that the patient voice is included. I'm glad that in your lab, like it is one of the priorities. I mean, because you bring kind of a patient lens and then also the researcher lens. Do you find that oftentimes you're also bringing in more patients into the research? So it's like, I guess, less biased when you are doing research?
I think so a bit. And I think like one of the things that's helpful is that I'm able to relate to the patients like or our research participants really well. And a lot of the time they'll say like I'm the first person they've ever met in person who has POTS. And so I think that kind of helps build the research relationship. And then I'm able to reach out to patients to get their input and feedback. So I think it really helps like having the experience as a patient to the research process.
Yeah, for sure. And then I wanted to talk to you a little bit about our scholarship. So you were one of the 2024 recipients of the Take a Paycheck STEM Without Limits Scholarship. I'm wondering how you heard about this opportunity. And yeah, just like tell me a little bit about, why you decided to apply and what your goals were when you were applying.
Yeah, and I'd just like to say again, like I'm so grateful to you and the Take a Paycheck Foundation for receiving this scholarship. I was really honored to be a recipient, and it makes such a big difference in my academic journey. So I'm very grateful. I believe I found the scholarship, I think it was listed in a U Calgary newsletter. And so that was when I found the scholarship. And then I looked at the information. That's sort of why I chose to apply. I thought that the Take a Paycheck Foundation seemed really cool and awesome, like to have an organization that's focused on young people, because I think a lot of the time when you think of chronic illness and illnesses and things like that, it's often focused on maybe older people, and that's not representative of who experiences, illness and rheumatic disease. So I thought the organization was really great. And so I thought I would apply, and I'm just really grateful to be a recipient.
Thanks so much. Honestly, it means a lot, especially because it was our first time ever doing something like this.
Mhm.
Seeing the amount of applicants we got and the diversity of applicants, especially because both of our recipients are now in Calgary,
Yeah.
which was pretty interesting. Like a lot of our applicants were from Alberta, and I was just so shocked that we could reach people there. So that was great to see. And so yeah, I'm really, really happy that you're one of our recipients. How did you decide how you were going to allocate the funding or like the scholarship to your educational journey?
I think there are like a lot of different, educational expenses, including ones that maybe people with chronic illnesses face that other people don't. And I think for me, because I knew that I was starting medical school in July and the tuition is quite large, I chose to put it towards my medical school tuition, just to help a bit with that cost. But I think there are many like worthwhile educational purchases, and especially things that will help you complete your education. So that's if you need adaptive technology, or if you need like a chair that's like going to help you, or like a sit to stand desk. I think there's many different, ways that would be worthwhile to spend the money. But just for me, it made the most sense to go towards my tuition.
Oh, that's amazing. Thanks for sharing. Yeah, there's definitely different ways that people can decide how they want to allocate it just based off of how the scholarship runs. For people who may be applying this year to our scholarship, which I'll talk a little bit about, what kind of advice would you give to them while filling out the application form, or even like deciding, should I apply to a scholarship? Yeah, what advice would you give?
Um, that's a great question. So I think for me, my approach is that I try to apply to everything that I'm eligible for. So I don't think about could I get the scholarship? Like, oh, I don't think I would get the scholarship. I just think like if I am eligible, I will apply and see what happens. So I would really encourage everyone to do that. Like I would say if you're thinking, oh, I don't know if I'd get it, like if you're eligible, apply it. Because even if you don't get it, every scholarship application is going to help you with the next one. So I would say my advice for that is apply. Like, don't worry about if you're good enough or anything like that. Just apply for it. And then I'd say like, the advice that I've kind of received for scholarships is it's really great to talk about how things like personally affected you. And I don't mean necessarily like personal information, but like if you just kind of list out your accomplishments, like, oh, I did this thing and then I got this award or whatever, like I feel like it doesn't really tell the story. But if you can talk about, I was in this leadership role and I developed these skills and this helped me to then do this other thing, it really helps like enrich your application. So I would say make sure that you're describing your experiences, what you did, what you learned, and how that's helped you in your educational journey, rather than just kind of a list, which is not as rich, I would say.
Yeah, no, for sure. I agree. I think definitely like making it a story and explaining your lived experience is so important because especially for us and like we started this program called the Young Scholars Program. Now moving forward, we will be adding additional scholarships every single year. And so it will be around the same time where our scholarships will release and a new one too this year. and some changes in kind of like the guidelines of like our past two scholarships. And so just anyone listening, stay tuned. And we also have some amazing videos that Kate and Maddie, our other recipient, did film. So if you want to learn a little bit about their journey, you definitely can on our website as well. And then I'll link the scholarship details like down below. But yeah, honestly, so amazing. I'm so glad that you were one of our recipients. But I'd like to kind of end off the podcast episode with an advice segment. What advice would you give to young adults who are unsure of their career path in the future?
Yeah, I think that's a great question. I think I have some different pieces of advice I'd say. I would say really explore like what you're interested in, what you're passionate about, and I would say like don't worry if you're not good at something right away. Like you can develop skills, but I just think it's really important to follow something that you're really interested in and passionate about and that you'd like to spend your whole life doing. And then I would also say things can happen unexpectedly. So I never thought that I would be doing a PhD. I never thought that I'd be studying POTS. Like I didn't even know what POTS was. I was sure I was going to do my undergrad. I was going to go to medical school. That was going to be my career path. And so I think being open to different experiences and also when things don't work out exactly as you expected, persevere and be determined and know that, you know, even this, if this is not exactly what you thought was going to happen, it could be even better. And I think that's my case. You know, I was so discouraged in undergrad when I had to drop out and I thought, no way could I be a doctor. I never saw that I would be doing an MD PhD degree. I never saw that I'd be going to Calgary. So I think maybe that's a little bit rambly, but I would just say be open to new experiences and maybe understand that things will work out even if it's not exactly the path that you saw in the first place.
And looking back on your previous experiences, what would you do differently?
That's a great question. Like, I think it was a little bit challenging. I think maybe I would have been more confident to seek accommodations early. I think that that was not great on my part, but again, a challenge. I think maybe being more confident to advocate for myself and being more confident that yes, I have like a medical condition, even though we don't know what it is, and that I do need accommodations, I think would be probably what I would change.
Thank you so much, Kate, for joining me on today's podcast episode. We talked a little bit about your diagnosis journey, the diagnosis delay from when you started to experience symptoms to how it affected your everyday life. You talked about how this impacted your confidence, attendance in school, and mobility. We discussed what it was like for you to learn about your diagnoses and how different people helped you along the way. We talked about your research and your passion for it, and then also a manuscript and the relationship between EDS and POTS, as well as your recent scholarship awarded from Take a Pain Check. So everyone like, comment, subscribe, check out Kate's social media channels, which I will link down below. And I'll see everyone in 2 weeks on Take a Pain Check. Thank you so much, Kate.
Thank you so much.
I can't hide.